My name is Barrett Walsh, and today I'm going to talk about non-suicidal self-injury. Self-injury in schools is an epidemic in Massachusetts these days. The most recent data from 2013 found that 14% of high schoolers and 14% of middle schoolers had self-injured during the previous year. It's an epidemic in Massachusetts, as it is throughout the United States and other developed countries. What is self-injury? Self-injury is when people deliberately hurt their bodies without suicidal intent, generally to reduce emotional distress. The most common forms of self-injury are cutting, self-hitting, burning, skin picking, and abrading, which refers to rubbing your skin until you create a wound. Another common form is hair pulling. In the last 15 years, there's been extensive empirical research on non-suicidal self-injury. The reason people self-injure is to reduce negative emotions such as anxiety, anger, sadness, shame, guilt, and depression. It's a myth that self-injury is attention-seeking. It's an emotion regulation behavior. However, there can be a social aspect in that social contagion of self-injury is a very common phenomenon in group settings such as schools, universities, group homes, psychiatric hospitals. So there is a social dimension, but the behavior is primarily about emotion regulation. It's important to emphasize for school personnel that self-injury is very different. It's separate and distinct from suicide. The methods associated with suicide in the United States are gunshot, overdose, hanging, jumping from a height, and ingesting poison such as carbon monoxide. Note how different those methods are from the primary methods of self-injury: cutting, skin picking, self-burning, self-hitting, and abrading. When it does occur, it does suggest that a child is in quite serious distress, and I would recommend a thorough psychological evaluation for such a student. Their behavior tends to be quite distinct from the common forms of self-injury found in middle schools and high schools. A very common problem in middle and high schools is the phenomenon of social contagion of self-injury. This is when diverse students start to trigger the behavior in each other. In a sense, they start to use self-injury as a way of communicating. And this can be a concern in schools because many students are affected, and it seems like the school personnel don't know what to do. As part of the school protocol that I developed around 15 years ago, we came up with some principles that we recommend to school staff when they encounter self-injury in multiple students. And that is, identify, if you can, which students are the most charismatic and influential in a group of peers who seem to be triggering self-injury in each other. You may want to speak with them first. And one of the interventions is to ask them to stop talking about self-injury with their friends, or texting pictures of their wounds to their friends via Instagram or text or email or whatever. That's often how the behavior spreads. And the request is that they stop talking about with their friends, not because they want to create some sort of scarlet letter or badge of shame related to self-injury. Rather, the explanation is there's ample empirical evidence that talking about the details of self-injury with your friends actually triggers the behavior in others. That is to say, it has the potential to hurt your friends. Of course, we're not in any way suggesting that we're condemning or judgmental about self-injury, but rather you need to talk to the right people. That means the school counselor, the therapist, the parent, if the parent is a trusted adult, and not to each other. Another recent finding in research about self-injury is that if it persists for an extended period of time, months into years, and if it involves multiple methods, people who perform such self-injury are prone to present with suicide attempts as well. Now, I want to emphasize it's suicide attempts, not death by suicide. Therefore, it's particularly important to intervene early in the game with self-injury because, in a sense, it solves two problems. One is it eliminates the self-injury and the bodily harm associated with it. But just as important, or perhaps more importantly, intervening early with self-injury prevents the emergence of suicide attempts. So that's an important consideration that school personnel and mental health professionals should be aware of. If school personnel, that is to say, teachers, coaches, cafeteria workers, anybody in the building, witnesses self-injury or sees people with scars or wounds, it's appropriate for them to contact point persons within the school. Point persons are people with mental health training. They're usually guidance counselors, psychologists, social workers, sometimes school nurses. The protocol involves evaluating the student, seeing if the student is presenting with self-injury or suicide. If they are cutting themselves, burning themselves, picking at their wounds, those types of behaviors, then after interviewing the student, it's often the conclusion that the behavior is about self-injury and not suicide. The protocol within a school setting is for the school professional to call a parent of the child while the child is present. They make it clear that this is not a disciplinary phone call, but rather the phone calls to indicate that they've discovered that the child is self-injuring. That behavior, to some extent, is normalized. The parent is told this is very common behavior in Massachusetts and beyond, but it does indicate your child is in distress. And the protocol recommends that the counselor in the school request that the parent seek outpatient counseling for the student. Note this is very different than a response to a suicide plan, which would require an emergency response in the school personnel, such as referring the student to a psychiatric emergency room for evaluation. The royal road to treating self-injury is to teach people new, healthy ways to regulate their emotions. Common examples of emotion regulation skills, or replacement skills as they're also called, are learning mindful breathing techniques that lower your heart rate, your respiration rate, and your blood pressure. Other examples are doing vigorous exercise that brings down urges to self-injure. And other examples include visualization, such as imagining a peaceful scene that brings down your level of distress. Similar examples include things like journaling, using artwork, or activities that distract you from your distress, such as going shopping, cooking, watching a funny movie. The important thing is that the student develop a toolkit of replacement skills. That is to say, a number of skills that work for that specific student. The toolkit is a list of skills that work, that brings down their level of distress. And the toolkit is something they should carry with them. It's not literally a toolbox, it's a list of skills. A list of skills can be carried on one's cell phone, on an index card in one's wallet, in a knapsack. The point is, when you start to get flooded with emotions, you pull out your list of skills and practice the one that appeals to you in the moment. Skills can be coached quite effectively by the point persons, the school personnel who have the mental health training. School personnel often see students multiple times per week when they're at their best and also at their worst. School personnel may well be able to coach the learning of replacement skills even more effectively than therapists who may only see them once or twice a week. And a key aspect of teaching skills is that they should be done with the student in a collaborative way, such as the counselor saying, you know, one of your triggers has happened that typically leads to self-injuring. This would be a good time to practice a skill. Which of the skills that we've been working on would you like to do with me right now? I have my own stresses today. Let's do it together. There is one type of self-injury that should be responded to as a crisis, and it's quite rare. And that form of self-injury is when people do significant damage to their bodies, requiring medical attention, such as multiple sutures or stitches. 90% or more of self-injury acts require no medical attention. When medical attention is required, that should be viewed as involving an especially exaggerated level of distress, which deserves an emergency assessment.
I'm so upset. David just broke up with me last night by text.
What? Girl, I just looked and he's deleted you off the gram. It says he's single.
Yeah, he unfollowed me on like everything. This is what he sent me last night. I don't understand why he would break up with me.
He's such a jerk. You're better off without him.
Yeah, but it hurts. When he told me last night, I kind of flipped out and cut myself, LOL.
Dee, that isn't funny. You cut yourself. That is a big deal.
I know, but I just don't get it, and it helps, or at least it did. I'm just stressed out, and today Miss Patrick wanted to spring a quiz on us. Who had time to read anything?
Dana, I think you gotta talk to someone about the whole cutting thing. We will worry about the quiz later.
I don't know. I gotta go. I think Miss Patrick sees my phone.
I'm coming right now. We're going to the counselor. This is more important than a quiz.
I just told you it's not a big deal.
I'll be there in a second.
Dana, I noticed you were using your phone in class. You know that is against school policy. What's going on with you? Dana, I noticed you've been distracted lately. You seem sad and your grades are trending in the wrong direction. There's no reason for you to be failing a quiz. Is there something you want to talk to me about? Hi, Dana. Do you have a minute to talk with me? You're one of the brightest students in the class, and sometimes when students like yourself are under intense academic and social stress, They look for ways to relieve that stress when they feel overwhelmed. Are you feeling overwhelmed? When a student appears in distress, stop what you are doing and give them your full attention. Be present. Listen actively and attentively and offer words of encouragement and hope. It is important to respond to self-injury with a low-key, dispassionate demeanor. Remember, if you suspect a young person is self-injuring, be sure to know your school's policies and protocols before intervening. As a general rule, it is important to notify the individual within your school that has mental health training. For example, a counselor, psychologist, social worker, or school nurse.